Advanced imaging review for final exam and VT&E. When we're doing ultrasound, having the terminology is going to be really important for us. Anechoic is going to appear black, an is without, echoic is echoes. So remember that ultrasound does not use radiation, it will be sending sound waves into our patient. Hypoechoic, hypo is low, so tissue that reflects back less sound than surrounding tissues. It will appear darker, so like a darker gray. Isoechoic, iso is the same, kind of like isotonic. And so this will be the same as surrounding tissues. It can blend in very well. Hyperechoic, hyper is going to be brighter, lighter, whiter. It's going to reflect back more sound than the surrounding tissues. When we're taking ultrasounds, we will have 3 different display modes. A mode is the oldest form. It's going to be measuring, and so this will be measurements. We don't really see a lot of anatomy when we're working in the A mode. It will be using peaks, and it will be part of our measurement system. B mode uses pixels and dots. This is what we currently use in practice. And M mode is going to be movement mode. So this is a continuous display of thin slices of the organ over time. We use this for measuring the heart chambers, motion of the cardiac walls and the valves to be able to see how things are moving along in there. So M is motion or movement. And so think about that as, like, say if we're measuring like the heart. The liver is in the cranial abdomen and it is of 5 lobes. It will have the gallbladder in there as well. And those will be between the medial and the quadrate lobes. The gallbladder will be between those medial and quadrate lobes of the liver, and it will appear anechoic in most situations without echoes or like a blackened color. It should usually be round or oval in shape, but the size can vary based on what is inside. We'll see bile typically as an anechoic coloration, so black coloration. Although if there are stones or some material that is echogenic, then it may be seen based on how the animal is positioning in a gravity-dependent position. So if the animal is standing, we might see it where gravity is going towards the belly. If they're laying on their side, it can be in a slightly different position. The kidneys will be in the retroperitoneal space. So they're not just free floating in the abdomen, they are actually in a space behind the peritoneum. The right kidney is more cranial than the left kidney, and the left kidney we can best visualize immediately caudal to that last rib. And so you can see on this image here, we have the cat and we're looking at placement of where to look. And so we're looking at that caudal to the last rib for the left kidney. Knowing that the right kidney is more cranial to the right, we sometimes have to get a little more creative with our positioning to be able to view this. The spleen is going to be mainly on the left side of the abdomen. So I really love this illustration to be able to show us the head, the body, and the tail. And it's divided into the 3 parts. In the notes section, there is a good tutorial from the Royal Veterinary College on how to visualize all of these organs on a YouTube video. So take a look at the notes and you'll be able to find that link to a really useful video. As we have to slide and rotate around the abdomen to be able to view different parts of the spleen. This is not going to show up just in one view. We're going to have to move around to check it out. Also keep in mind too that the spleen is going to be hyperechoic to the liver. So hyperechoic, it's going to be brighter, lighter, whiter than the liver. The urinary bladder will be in the caudoventral abdomen, and it can vary in size depending on how much urine is present. Urine should be anechoic, so it should be blackened in color. And depending on how much is in the colon, we may see some variation in size and shape of the bladder based on the pressure. As we do other modalities of advanced imaging, MRI versus CAT scan. MRI is going to utilize the magnetic fields and radio frequencies. This is going to allow us to see normal versus abnormal tissue a little easier, and this is best used on the spinal cord. We usually will find more MRIs, locally here at least, MRI is more readily available. CAT scan, on the other hand, uses radiation, but it is a faster procedure. From my last visit to the specialist veterinary hospital, they said that they can do a CAT in like 5 minutes or less. So I thought that was super duper cool. Neurological cases, seizures, tumors, GI issues. The MRI can have some GI artifacts that can make it a little harder to visualize. And so CAT scan is going to be a little more of a better modality to view GI issues. And we can even enhance these using contrast dyes. The contrast dyes, keep in mind, have to be able to inject para-enterally around the GI tract. These have to be IV. This is not something that you're going to be able to use regular barium for. Fluoroscopy is another one, and fluoroscopy can be like a table or it can be a C-arm, and these are real-time issues now, or images. So as we view fluoroscopy, this is going to be used for things like swallow studies. Now there is going to be a great deal of radiation involved with this, so we use this for little tiny bits of time, and you have to have additional dosimetry to monitor. So your dosimeter badge, but often a ring dosimeter as well. Contrast studies, remember when we do our contrast studies that survey radiographs are going to be mandatory. We need to make sure that we have the proper settings before we place something in that is going to be time-based. You can't go back. You have to redo the whole entire study if you miss out on what you needed. So our survey radiographs can even help to reduce the need for the study. We're going to make sure that we label our radiographs after each image with the time and what was administered to our patient, what type of contrast medium. Negative contrast is going to be agents with low atomic weights, like air. So we can introduce air into our patient. It's not going to block X-rays. Radiation will pass through without being stopped. And this will give us a black area on the film. So negative contrast is going to be like radiolucent. It will pass through unhindered. We do have to be careful not to overinflate the organ, or we could have issues like similar to that of a GDV, where we could have potentially too much pressure and cardiac arrest. Barium sulfate is going to be our positive contrast. So air was negative, barium is positive. And barium sulfate itself is meant only for the GI tract. So it should never go in the lungs. It should never leave the GI tract. Peritonitis can happen. These can be life-threatening conditions if it escapes the GI tract. And so barium sulfate is excellent in that it's a very heavy metal. It blocks the radiation and passes through, and it kind of can work to push things through as well. So we do have to be careful with the administration of it. Another thing to consider too is if we are placing barium in the GI tract, if we need to tube the dog or cat to place this, make sure we go in the right tube, instill a little sterile water first, check for any coughing. As we administer it, we want to wrap the animal up in a towel or a blanket, and we want to administer this not in our radiology room. So that way, if they shake their heads, if they vomit, we're not going to be spitting it out on the table in an area that could ruin future radiographs. Double contrast procedures are another option where we utilize both positive and negative contrast. This is often urinary bladder, stomach, colon, places like that. And what we do is we add the negative contrast first, the air, and then we'll follow with positive contrast. That way we prevent air bubbles from forming, which can obscure what we're trying to see. Advanced imaging modalities. Does it use radiation? X-rays, yes, are going to use radiation. Ultrasound, no, it uses sound waves. Endoscopy, no, this uses a camera on a long fiber optic tube. Remember that we don't want to bend it, we don't want to drop it. We have to be very careful handling our endoscope. Fluoroscopy, yes, we use a very high amount of radiation, but only for short clips of time. MRI, magnetic resonance imaging, no, we're going to use magnets. So we need to make sure that we do not have anything metallic in the room, otherwise it can rush towards the machine. Computed tomography, CAT scan, yes, we do use radiation in this case, but it is a very short procedure, still not something you should be in the room for.